Good morning. Today's episode of Apollo 24/7's Health Hour is a very important one. As the country is grappling with the second wave of coronavirus, it is important to be updated. If you have any question regarding COVID-19, the safety protocols, vaccines, do's and don'ts, or to take care of a person who is in home isolation or any other COVID-19 related query, join us live 11 a.m. today. We are bringing you a very senior pulmonologist and a COVID warrior, Dr. Viny Kantroo from Apollo Hospitals, Delhi, who is going to answer all your questions in the live session. I have my questions ready, so join us with your family and friends and all the questions that you may want to ask. See you there.
Always been there, standing between you and your health. A wall. Between a pain that won't disappear and a doctor who magically appears. Between a long wait on a hospital bench and staying right where you are, at home. Between finding yourself out of medicines and finding them at your doorstep, whatever the time. Between years of health records all over the place and all your records in one organized access from anywhere place. Between your current regimen and the recommended routine. The wall. We don't need it anymore. Say hello to Apollo 24/7. This is India's largest end-to-end omni-channel healthcare ecosystem, designed to touch more lives than ever before and delivering its promise in 3 important ways. 1. Listen. Talk to us anytime from anywhere. We've got 7,000 doctors and 30,000 healthcare professionals listening. 2. Advise. We'll give you expert advice you can rely on, because it comes from India's #1 healthcare provider. 3. Assist. We bring you India's largest health network of pharmacies, clinics, hospitals and health insurance experts. 20 million people already trust us for their care, and a further 50,000 people are discovering this every day. Apollo 24/7. Expertise is for everyone.
Namaskar and welcome to Apollo 7's Health Hour. The topic for today is defeating COVID-19 together with Apollo's expertise. I welcome the audience who are watching us on various platforms of Apollo Hospitals Group, Apollo 24/7 and Network 18. Today, as the entire nation is grappling with this deadly second wave of coronavirus, everyone needs to follow safety measures and do everything possible to keep themselves safe. And that is the need of the hour. Apollo Health Hour, Apollo 24/7 brings you experts every week, wherein Apollo experts will reach out to you to address the queries every Sunday and discuss a problem area where you can join us and chat and ask all the questions. We shall take these concerns in the live session. In today's session of Apollo 24/7's Health Hour, we are giving you an opportunity to talk and understand, spread awareness about the second wave and the steps and measures required to control the spread with expert pulmonologist from Apollo Indraprastha Hospital, Dr. Viny Kantroo. She's going to join us in a while. So this is the time that we need to take care of ourselves. COVID-19 का एक ही हाल है, एक ही solution है, वो vaccine लेना. With the launch of the COVID-19 vaccines, it's time to ensure that every Indian gets the shot of life. Federal Bank and Network 18's initiative Sanjeevani aims to do this to help Indians get a shot of healthy life. With the first of its kind of COVID-19 vaccination drive, it also aims to create awareness, initiate conversations, and enable change and create impact towards the better health outcomes. The vaccination partner and the health expert for this novel cause of vaccinating the entire country is Apollo 24/7, which is going to be a catalyst in contributing to a safer, vaccinated, and healthier India. So our good Samaritan and the project's brand ambassador, Sonu Sood, has taken a vaccine shot at Apollo Hospital after booking his slot on Apollo 24/7 app under the Sanjeevani initiative. Let's have a look at this audiovisual.
Our campaign ambassador Sonu Sood was able to get a hassle-free jab done, all thanks to our health expert on the campaign, Apollo 24/7. Earlier, he used the Apollo 24/7 app to register himself in what is a very easy and quick process.
Hi everyone, so all set. So today is a vaccine day. आज मैं पहली दफ़ा जाकर I'm taking the shot and I'm pretty excited and I just want everyone to follow this. Today I'm in very safe hands of the nurses, doctors and staff of Apollo 24/7. So all set, let's follow. So all done. पता भी नहीं चलेगा आपको, लेकिन आपकी सेहत को ज़रूर पता चलेगा कि आप एकदम सुरक्षित हो. So just go have your vaccine today. So the vaccine is done. एक बहुत ही important चीज़ आपको याद रखना है कि वैक्सीन लेने के बाद 30 मिनट्स तक डॉक्टर्स के पास रहना है. आई थिंक छोटी सी जिम्मेदारी आपके देश के लिए. थैंक यू.
So that is Mr. Sonu Sood. Mr. Sonu Sood ने वैक्सीन लगा लिया है. क्या आपने लगाया है? अगर नहीं लगाया है, if you are above 45-year-old, then you should get your vaccinations. And if you are below 45, wait for the turn. It's going to be very shortly announced for all of us. So it's a very simple 3 steps that you can follow. If you want to get vaccinated, you can register yourself on Apollo 24/7 first. आप Apollo 24/7 app download कीजिए. Then you can click on book vaccination slot. We will make sure that there's a schedule vaccination, and once your vaccination is scheduled, you will be notified. बस nearest Apollo hospital आपको app बता देगा, आप जाइए और आपका shot ले लीजिए. It is as simple as that. You can download it from your Play Store or any other app आपके provider, or you can scan the link or scan the QR code which is on the screen. You can download the app. There is a link which is given in the chat box also. You can download Apollo 247 from there. All right, let's start today's discussion. There are a lot of people waiting with a lot of questions and queries, and I have our expert who's going to join us, Dr. Viny Kantroo, the consultant senior pulmonologist and respiratory medicine specialist at Apollo Hospitals, Delhi, Noida, specializes in respiratory illnesses, asthma, critical care, and sleep medicine, who's a gold medalist in MBBS and over 15 years of experience hai unka, or she's a part of teams involved in various multi-center research trials on COVID-19. She's a faculty for DNB Pulmonology and Critical Care. She's published various national and international journals. Thank you so much, Dr. Viny Kantroo, for joining us today. I know it's a very, very tough time for you all out there in Delhi, and the entire nation is fighting. Thank you so much for being there for us.
Thank you so much, Jhansi and Team 247 and Apollo Hospitals. I'm really indebted to all of you that you have called me on this platform to really give some awareness about COVID-19, because people are at the moment frantically calling and wanting to have this advice. I'm sure it's going to be a useful session for each and everybody who has logged in and who is watching. And I will try to be of maximum help and give as much of information as possible.
Abhi, ma'am, thank you so much. We understand the pressure of time that you have. And quickly, ma'am, there is the second wave which is grappling us right now. Is there a difference? We hear about double mutant, triple mutant. Is the virus different from the first one? And how is it affecting us?
Yeah, definitely the second wave is much more aggressive, which everybody by now knows. The numbers are exceedingly large. There's no doubt about it. And every state is just grappling with the numbers at the moment. It's too early to say what are the causes that we have been experiencing this deadly wave in a more aggressive way. But what are the possibilities is that the COVID appropriate behavior has not been following in the previous months. You know, everybody has got fatigued. सब थक चुके हैं, मास्क पहन के, शारीरिक दूरी बनाए रखने से, हाथ धो धो के. Although this is the only way we can defeat this deadly virus in the longer term. So we shouldn't forget these three things, which can be summated as SMS, which is adequate, distance between yourself and the other person, masking, of course, and sanitizing your hands. In addition, the other and the best possible bet at the moment, which we have, is definitely vaccination. Now, we will come to this later, whether the vaccination is useful, whether it is not, how useful it is, how you can take it, and how long it is going to stay. But I would like to reiterate that this is the best bet we have at the moment possible through which we can defeat this virus. Now comes the possibilities. Why is this wave aggressive? As I told, the vaccine the COVID inappropriate behavior which has been there, maybe due to fatigue, maybe due to inadequate knowledge, maybe due to people not following the rules. I mean, there are straight off people who don't want to wear masks. The other possibilities include, yes, the possibility of mutants, respiratory viruses. जितने भी respiratory viruses होते हैं, जिनमें से एक influenza भी होता है, they are known to have these mutations every year and every month. Now, ये mutations कितने important होते हैं, how clinically important they are or they are not, is decided by the scientists who study these viruses, and also by their clinical presentation. So this is not new that the viruses are undergoing mutations. Respiratory viruses are known to have mutations. This is the reason we have to take the influenza shot every year, because the virus undergoes mutations and we have to formulate a certain kind of vaccines which are updated every year. So yes, possibility of mutants. The third possibility could be temperature changes. We have influenza, which is very aggressive during the winter months. Now here we can have COVID-19, which may be more aggressive during the summer months. But I should tell this fact that there are still certain knowledge gaps which we don't have at the moment regarding this virus. And we do need in-depth knowledge and more research in terms of this virus, where we can intervene and then later on formulate guidelines.
but whatever it is, we should not forget to follow COVID appropriate behavior is one, and get vaccinated.
Definitely.
There are a lot of people who are being affected, and there is worry, there is fear, panic all over. And ये beds नहीं मिलते हैं या shortage of drugs है, oxygen है, ये तो और ही fear create करके छोड़ा है. How does one understand अगर वो infected है, अगर वो tested positive है, who has to worry and who has to reach hospital? Home isolation के कुछ tips है क्या?
जी देखिए, बहुत आसान है. जैसे टाइम टू टाइम टीवी पे भी बताया जाता है, हमारे कंट्री के बहुत ही अच्छे गाइडलाइंस है. देयर आर गाइडलाइंस फॉर्मुलेटेड फॉर 3 स्टेट ऑफ पीपल फॉर कोविड पेशेंट्स. You know, those who are mild kind of cases, they have fever in the first week, they have coughing, slight bit of coughing, they have headaches, they have body aches, they have joint pains, they have runny nose, some of them have stuffy nose, some of them have diarrhea. So these are the presenting features of COVID-19 which come in the first week of illness. So please remember, these are the milder kind of symptoms with which this disease presents. So you don't have to get panicky. I must reiterate the fact that COVID, in addition to causing physical problems in a particular person, does cause mental health problems and issues. There is a lot of anxiety related to these kind of symptoms, and every patient is, frantically calling and wanting to have a chat with their doctor, which I think should be, triaged at the moment. Everybody should be aware, and they should help to get the anxiety down by helping the other people who are actually in need of the doctor and who need immediate attention. So first week is the week where you will experience these mild kind of symptoms, and your oxygen saturation, even if it is 93, 94, that is considered normal. So please don't consider that this is abnormal. Everybody calls in, gets oxygen concentrators, holds them, keeps oxygen cylinders, depriving other people who might be in dire need of them. So please don't do this. Home isolation, you need to be immediately isolated in a room so that you protect your elderly and your other family members. In addition to that, maintain a very good hydration. Also, you can eat anything except very cold beverages which are directly taken out of the fridge. There is no restriction on any kind of fruit or food. These are the most common questions which people keep on answering again and again and messaging again and again. So there is no restriction at all. Treat it as a small, simple flu. एक जुकाम की तरह इसको treat करें और symptomatic treatment ले. जैसे बुखार के लिए पैरासीटामोल ले, अगर थोड़ी बहुत कफ है तो कफ सिरप ले. ये ओवर द काउंटर मेडिकेशंस है, यानी कि इसको लेने के लिए आपको कोई प्रिस्क्रिप्शन की जरूरत नहीं है. You can get them from any chemist in throughout the country. So अपनी hydration बनाए रखना बहुत जरूरी है. Rest is important, but you should also keep in mind, especially those who are more than 40 years of age. COVID is a disease which causes more coagulation in the blood. So this is the reason we reiterate this fact that you have to keep your hydration very good. जब आप अपनी hydration अच्छी रखते हैं तो blood का flow अच्छा होता है. In addition, आप बहुत ज्यादा सोते हैं तो blood की जो stasis है, जो एक जगह रहने की प्रवृत्ति है, उससे clots बनते हैं. So that is why I keep saying don't rest whole of your day. So keep on moving in the house, keep on doing your job. Go back to your hobbies, listen to music, take care of your mental health, eat whatever you like. And in addition, you can take warm water, which will soothe your throat. It's not the treatment for COVID-19. The virus is not going to get out of your body. But yes, it will soothe your throat and will give you a good feeling. Now comes the strata, which is the moderate disease. Now, these cases decided on case-to-case basis can be managed at home, and if they are picked up early. For example, people who have saturation between 90 to 92, along with certain comorbidities. They have had cancer in the past, they have had diabetes, they have hypertension, they have kidney failure, they have heart disease. All these people, they need immediate attention, and possibly if they are going, if the access to a CT scan center is available, they should do a CT scan in the following circumstances. If your fever is lasting more than day 8, if you have persistence of hacking cough, which is the cough which is not going at all. And if you have a restriction in your breath, you're not able to take your breath deeply. And the moment you try to take your breath deeply, there's a bout of coughing which comes from inside. In addition, positional changes in saturation. Sitting up, the saturation comes to be 91, and while you lie down, the saturation goes up to 94. So these are certain kind of early warning signs where a CT scan will help us, the doctor, to decide whether you need any additional medication, which is in the form of steroids. So also those people who are visibly breathless, they can't take their breath and the oxygen saturation is less than 90. If they are tackled within these 1 or 2 days and given steroid appropriately at an appropriate time in a specific dose, they can be tackled at home. Yes, of course, you have to remember, if you sleep on your tummy, this does increase your oxygen levels to a reasonably good level. And this is a strategy which we follow in cases of respiratory involvement, which is something called acute lung injury. So we do follow this strategy of telling people to sleep on their tummy. Again, maintaining good hydration and keeping on moving your legs, even passively. If you are not able to get out of your bed, keep moving your toes, keep moving your muscles of the legs, which can increase the blood flows. Now comes the third strata, which is the severe kind of disease, which is decided by the fact that somebody is visibly breathless. Somebody has an oxygen saturation which is less than 88. Also, certain people may not have pulse oximeters handy at their house. In those cases, if you see your mother or father or the affected person has a blue tongue, now that is a sign when these people need hospitalization because the oxygen levels are critically low. So having a blue tongue, yes, oxygen saturation less than 88, visibly breathless, not able to maintain at all. And after giving oxygenation also, the oxygen saturation comes to 88 or 90. These are the people who need additional help in hospital. Even if the hospital is not available at that point of time and you are trying to search for the appropriate help, in between you can have the steroids which will help. Sleeping on your tummy will help, and also oxygen inhalation to keep your saturation 90. Now 90 is the saturation which is considered normal for normal people. Don't consider 100% saturation as normal. 90 or 92 is a reasonable level of oxygen which is considered normal, and beyond 93, even if you increase your oxygen levels, your hemoglobin which binds the oxygen is not going to take up further oxygen. So people, if they go on to 93, 94, at home they start oxygen inhalation. Please remember, oxygen is not the treatment for COVID-19 virus. It's not going to kill the virus. It is a symptomatic relief to get your oxygen to a safe possible level. So these are the three strata which is decided by your doctor.
Wonderful, ma'am. So first thing, no panic, treat it jitna ho sake ghar pe kar sakte hain, and coming to hospitals and using the resources wisely for the people who are in requirement is the need of the hour for the country. Thank you so much for reiterating the entire process once again, ma'am. Ma'am, I should start asking the questions which are here on the YouTube chat, ma'am.
Yeah,
Roy has asked, his father has tested COVID-19 positive on 21st April, but his fever is still 101 to 102 temperature. Paracetamol and other medications, including doxyxyl, are going on. Is fever common? Will it continue like this?
Fever is the most common symptom of COVID-19 disease. We did a study here in Apollo Hospitals on 1,000 people, the first 1,000 people, and fever was seen to be present in 85% of them. The reason other people may not mount fever are many, because elderly, they don't mount fever sometimes to any kind of disease. So elderly, having an immunocompromised state, being on steroid previously for any other condition, or any immunosuppressive therapy. These are the strata of people who may not mount a fever response from the body. But other 85 to 90% of the people will mount fever. It's a very common symptom. Within the first 7 days, even if the fever is going up to 101 or 101.5, you should not be worrying and not be panicking actually. Just relax, take the paracetamol. If you have any comorbidities like diabetes, heart disease, renal disease, post-transplant status, or any kind of immunosuppressive therapy, you're a cancer survivor, you should go back to your doctor who will decide whether you need additional therapy or not. But within the 7 days, the use of steroids is detrimental for each and every one of us. But if the fever is continuing beyond 7 days, as I reiterated earlier, that the features like having fever beyond 7 days, having breathlessness, being short of breath, having heavy chest, having the kind of hacking cough, which is not going back, and having the positional changes in saturation, then you might need a CT scan, which can then be read by a radiologist and your doctor, and to decide whether you need any steroids or not.
All right. Here was a past case of COVID-19 September 2020 में उनका COVID हुआ है. Father, 56-year-old, 30 days he was in hospitalization, NIV पे था. Then mild sensory lobular emphysema, traction
Bronchiectasis.
Yes, ma'am. Well, thank you for helping me out with that. So, and now his saturation after 6 months, 6-minute walk, his SpO2 ranges between 90 and 94. Is this okay?
Well, as I reiterated the fact that having a saturation of 90 to 94 is considered normal. This is low normal for certain strata of people, like for your father who had suffered a severe kind of disease back in September. Now, I would like to tell to people that there is a strata of people who go on to long COVID. Long COVID is something which happens after 4 to 6 weeks of COVID-19 disease, more common in severe and moderate cases. It is due to the changes which the opacities cause in your lung. It is the scarring which might be left with the opacities in the lung. So the particular person has scarring in the lungs, which causes the oxygen to be chronically low.
Okay.
Right. The other problems which might come up would be the airway hyperreactiveness, where a person would be having more kind of cough. They would be more breathless due to the constriction of the breathing tube. The third one is due to the heart problems, which might be caused in severe cases, which is called as myocarditis. This needs to be looked after by an echo, which is ultrasound of the heart. And the other problems like bronchiectasis, where there is stasis of secretions फंस जाते हैं, निकल नहीं पाते हैं, और उसकी वजह से जो है इन्फेक्शन बनता रहता है. इस कंडीशन के लिए आपको अपने रेगुलर डॉक्टर के साथ संपर्क में रहना चाहिए और देखना चाहिए कि किस तरीके से उनको हेल्प हो सकता है. So one of the things is pulmonary rehabilitation, which is very, very helpful in these kind of strata of people. So you will be helped because there is bronchiectasis, the positional changes and cupping physiotherapy of your chest will help bring out the secretions. If there is infection which is going on in the body, your doctor will prescribe some antibiotics, and doing exercise per se will train your muscles to use less of oxygen so that the oxygen is diverted to more vital organs. So respiratory rehabilitation is what is required for your father, in addition to getting vaccinated. So those people who already have suffered COVID-19 in the past, beyond 90 days, even the severe kind of cases, the day they had their first symptom, and counting from that, beyond 90 days, they should get vaccinated against this particular disease, because the amount of immunity and the robust immunity which is brought back by getting these jabs is absolutely good, and it saves you from severe kind of disease which a particular person might go into. So vaccination in addition to respiratory rehabilitation.
Right, ma'am. So that answers a few questions who were asking, we had COVID infection in the past, should we get the vaccination done? So that answers the question. Would you want to again emphasize on the vaccination after COVID, ma'am?
Yes, so after COVID, certain people are getting their first jab and coming back with to the doctor that I had my jab on this particular day, and then followed by 5 to 7 days after I have the symptoms. Now I have tested myself. I'm tested positive. This vaccination is farce. This is not working. How can a vaccine not prevent me from getting the disease? So please sit down and have faith on the system and your scientists. The scientists are human beings. They have to work on certain lines and guidelines. So they have made certain vaccines which are really effective. The studies which are conducted on a large number of people, they have shown that Covaxin or Covishield, if I take it, an average kind of figure, they are effective between 60 to 70%. So this is the figure which is true for each and every kind of vaccine. Before the WhatsApp University, nobody knew how effective the vaccines are. Every year we used to get the patients vaccinated against influenza, and every 5 years we go for the pneumococcal vaccination. Nobody ever raised any concerns. Are these vaccines effective? So you have to give the system and your scientists time, because human body is very complex. It's not a machine. I switch off my computer, I switch it on again, I unmute myself, I show my video. These are very simple things. Human body is complex. How a vaccine works in one person, it really depends on their system and their immunity as compared to other person and how he will react to it. We need longer kind of, longer term studies between different strata of people, different conditions of people. People are different, their genetics are different. So we need a longer term data over 1 to 2 years to really tell what is effective and what is not. But at the moment, this is the best bet. The vaccine will work after the second dose is given, and that too after 2 to 4 weeks. So if you're getting COVID-19 infection between first and second dose, especially 5 to 7 days after your vaccination, that is more due to your COVID inappropriate behavior rather than the vaccination. Because the moment you thought you're getting the jab, you thought the COVID is over, and I am now able to move around freely. I can go anywhere without the mask. I can touch any damn thing. I don't wash my hands, and I'll be with my friends. I'll have a small drink with my friends. So this is not appropriate. You have to follow COVID appropriate behavior and prevent yourself from COVID-19 for yourself also and for the people who are around you. Yes, so having this disease means that you went into the center and probably something went wrong and you caught the disease per se rather than the vaccination being plain. Now, if you got COVID-19 in between your 2 shots, when should you take the second dose? Again, you should take the second dose after 90 days of your first symptom. This is especially true for moderate to severe cases who take a longer time to recuperate from their disease. It's not that 4 weeks, 2 to 4 weeks is the time that they get completely fine. Now, CDC says the vaccine can be taken after 2 weeks of your disease. But I consider it, a little bit earlier, because people are still recuperating at that point of time, especially the moderate to severe cases. They should wait for 90 days for the body to get better and for the immune cells to give their own time to recover. We might confuse the immune system having the disease, having the vaccine, and then the reality might be something different. So wait for 90 days and go for the jab.
Right. So if you're infected, wait for 90 days is what Dr. Viny Kantroo is reiterating. Next question is on Network 18's YouTube channel. Ramprasad Velogodu is asking, he had a blood clot bluish patch at the site of prick during the first dose of Covishield vaccination. Now my doubt is about taking the second dose. Any precautions to be taken?
This needs to be discussed with your healthcare professional who has been taking care of you in the longer term. First, the second point is the bluish discoloration which you had is not a clot. I have received these calls many number of times, even for my relative, from my relatives. I developed a bluish discoloration at the site of my vaccination. The bluish discoloration means that you had a little bit of bleeding into your skin, which will change colors from blue to yellow to purple to n number of colors. So that is the hemoglobin getting absorbed again into your body. So this is not the indication that you had a clot inside your body. Maybe you are on blood thinners. I don't know the details, but yes, discuss with your healthcare professional who has been in touch with you on a longer term. He will be able to guide you. But if it was just a simple little bleeding into the skin, you can go for the vaccination.
Right. A lot of questions regarding vaccination and doubts, ma'am. Covishield इन्होंने 2 बार ले चुके हैं, but should he go for a third dose?
Well, this is something which the research is still studying. The scientists are still studying this fact. So if you're so ahead in terms of thinking, I really urge you to please come and join the scientific community and give your inputs. We are still studying whether we should take further shots of vaccination, whether they should be taken at 6 months or 1 year or 2 years, depends upon the credible immunity which the vaccination will give to particular people. So we are trying to study how much the immunity will last, which we do not know at the moment. We need to have studies to know this, and then this will be decided how many number of shots we will take.
Okay. Mr. Bhuvan Pawar says the next question. He's taking vapor, mild COVID लगता है इनको. He's steaming, inhaling, gargling with milk and turmeric. Symptoms aren't visible. No cough, no cold. Is this enough? और घर पे बैठ के medication भी लेना है इनको.
Well, somebody who's getting good with these kind of therapies, I should say they're all lucky and they should do what they are doing. I just reiterated the fact in mild disease, there's not much which you need. You can use over the counter drugs which are available with your chemist. You have been treating your flu on your own many number of times. And if the symptoms are mild, you should keep your hydration good, keep walking and keep using things which soothe your throat and your nose.
Right. Somebody has high blood pressure due to anxiety, and ये anxiety में vaccine ले सकते हैं या नहीं?
This is a very difficult question. You know, when the vaccine came in, the healthcare professionals were the first to be the guinea pigs per se. So our community did have this kind of anxiety. And there were certain people who were COVID warriors, and they were told that they will be given the vaccination first. So we did also have this anxiety in our minds because we were chosen first. I was asked whether I'll be taking the first jab. So I had this anxiety in my mind, but I would like to tell you there are hundreds and millions of people who have taken this vaccine all over the world now, including India. So your anxiety should be allayed by the fact that many number of people have taken this vaccine and it is visibly safe now. Please allay your anxiety. Take your medication for your hypertension, go to the center with a positive thought that despite helping yourself also, you are doing a service to the community by getting immunized against this disease and helping at large to contain this pandemic.
Right. Thank you so much, ma'am. Harpreet Kaur पूछते हैं, is a simple cloth mask sufficient? Or do we need to take extra precautions? अभी दो मास्क तीन मास्क के बारे में सुन रहे हैं. Is it right, ma'am?
See, this is a difficult question at the moment, but if you don't have anything handy and you're going to a place which is kind of open air and there's not much people around, you're exercising in the morning, yes, a cloth mask can be important, especially if it prevents the sprinkling of your saliva which falls around on people and causes COVID-19. So cloth mask is efficient in preventing these sprinkles of saliva which come out of your mouth, yes. And if it is an open air area where you are exercising, it is perfectly okay to have a cloth mask. But if you're going to a crowded place where you know that the possibility of you getting into touch or coming into contact with the persons with COVID-19 is high, then and especially those people who have comorbidities, like who are transplant patients, who have cardiac history, who are on immunosuppressive drugs, and who have history of kidney disease especially, they should be using appropriate masks, especially when visiting their hospital to have their regular checkups. When you're in a public place, which is not a hospital, you're exercising, cloth mask can be sufficient.
All right. Ma'am, network 18 पे एक और क्वेश्चन है अश्विनी गुप्ता जी का. Sister, 46-year-old woman, mild BP is positive. Then she's already taking Azax and other ivermectin and other medications as prescribed. But past 4 days her fever is only 99. Further, does she require Fabiflu? Follow-up necessity with administering remdesivir? Is this necessary for them? There's so much of confusion about these drugs.
Well, the drugs which are used in certain strata of people of COVID-19, the mild kind, I already told, only symptomatic relief. There is no role of remdesivir, steroid, or any other over-the-counter drugs in the mild kind of disease. Fabiflu, some data, ivermectin, some data, but not any kind of robust data to back them up. If you're not finding these drugs in the present scenario, if you're not able to get them anywhere, they are not an absolute necessity. You will get better if you have mild disease. So if you're not getting Fabiflu, you're not getting ivermectin because the demand is huge, please don't stick to having these drugs and go from one center to other center hoarding these drugs. Please don't do it. Just have the symptomatic treatment. Fabiflu may be important, not a very robust data. In fact, in my own personal experience, I haven't seen much of an effect on people. But yes, those with comorbidities like cardiac, renal disease, transplant patients, we sometimes do use in mild to moderate disease, but not in mild kind of cases. They don't require remdesivir, steroid, tocilizumab. So please don't hoard them at home and keep them for people who really need it.
Right, that's a great piece of advice, ma'am, because that's the need of the hour for the country as well. Well, this is Mr. Ved Paul who's asking that three members living in one apartment. Wife and he are tested positive. Son is negative. Can me and my wife share one room? This is very important as we are all isolating at home, ma'am.
Definitely, two people living within a single house, if they are tested positive, they can live together because 99% of the chance that they have infected each other and they are going to have the same kind of strain. Secondly, even if they have two different strains, it's not clinically significant that they will keep on infecting each other. Each is recuperating with their illness. They will have particular kind of immunity at that point in time. And sharing a room with your partner who's already been there before your exposure. The COVID-19 is actually important. The incubation period, when you don't have the symptoms, the day you started with your symptoms, even 72 hours before that, you have already spread that virus. So most probable that in your house, you were living together, and when you got the symptom, you isolated yourself. This is the reason that even if people isolate at their home, people keep asking me that why did we get infected? We had isolated on the first day of symptoms. So even before 72 hours, you were shedding the virus and spreading it. Right, so that is the reason people living in same house, they can live together. They have infected each other and they will recuperate faster if they are kept together rather than in isolation, because it's really important for your mental health. Yes, the person who is negative needs to be isolated.
Okay. Next question is, which kind of vaccine is best for a 69-year-old person? Do we have a choice here, ma'am, Covishield, Covaxin, or do I wait for the other vaccines to come into India?
Right. See, till now, we didn't have any choice between these vaccines. But since the government of India has made these vaccines available now as a part of private healthcare, you can buy these vaccines. So you actually can select your vaccines at the moment. But there is no clinically significant difference at the moment in terms of Covishield or Covaxin. This will be decided in future because we have to have head-to-head studies between different vaccines and follow people at least over 1 year to see their comparative effectivity and their further side effects and further use in the community as a whole.
Okay, so as of now, everything is good. If you want to be safe, please go ahead and get your vaccination done. Vishwanathan Sridharan is asking this question. Like malaria, is there a chance of COVID relapse?
Relapse is something else. Malaria actually is a parasite which stays inside your spleen and liver. So that is why there is a relapse. It kind of gets hidden inside your blood cells. Same is true for tuberculosis. The drugs which are used for these particular diseases, they don't penetrate the cells, and hence there is a relapse. That means that the particular organism was already present inside your body, and a little bit of decrease in your body immunity has caused a resurgence of the same kind of organism. Now, having a reinfection is something different. It means that you were cured of a particular disease and then you caught the infection again. So reinfection, there have been few cases. We still need a larger study to prove this. I, in my personal experience, have seen that those patients last time who were really asymptomatic, who didn't have much symptoms, they just had stuffy nose, little bit of flu-like symptoms, body ache here and there, and next day they got better. These are the ones who got the reinfection again. It may be the fact that at that particular time, the body didn't get sufficient time to mount that particular response or immunity to prevent you from future infections. But still, we need to study these cases of reinfection to come to a particular conclusion.
Share some information about plasma therapy in COVID-19 patients. Rohini Doshetty is asking this.
Plasma therapy is especially useful for severe people, those who are visibly breathless. The saturation is less than 88, and they have multi-organ involvement, which means that the kidney might be involved, the liver has got into a dysfunction. So these are the strata of people who are admitted to the ICU. Plasma therapy per se is useful when it is given within 72 hours. So this has been studied in few studies only. Again, we don't have any robust data to say that yes, plasma therapy is really helpful. The studies are still going on, but at the moment we are using plasma therapy for people where the disease is less than 72 hours, or maybe in some cases up to 10 days, and especially if your antibodies are negative. This is not for mild people, this is not for moderate people. There's not even a single study which has shown a good amount of benefit as compared to steroids, which have shown mortality benefit, which means that if it is given to people who really require it, it has prevented deaths. So plasma therapy is not the therapy which has shown this kind of benefit.
Okay. Next question is from Mr. Priyanshu Mittal. I have asthma, 55-year-old. Is vaccine safe for me?
Yes, absolutely. The vaccine is safe for you. A lot of my asthma patients have undergone vaccination. You should keep one thing in mind. If you're having acute exacerbation of your symptoms at the moment, if you have small little flu, or if you have COVID-19 mild kind of disease, you should wait for 6 weeks and then get your vaccination done. Otherwise, if you're well controlled, you can go and get the jab done.
Okay. Abhishek Kaushik ji puchte, is it helpful to have oxygen concentrators at home?
I will again say, please do not hoard things. Take care of the resources. In addition to your government and your doctors, your healthcare professionals, your nurses helping you, we need the help of whole nation. Otherwise, a pandemic of such a scale is not going to go down on its knees. You know, it's not a one-sided story, it's a two-sided story. Everybody has to work for the country. This is the time where you can help your fellow citizens who are actually in need of the oxygen. So please, for mild disease, don't keep an oxygen concentrator at home. If you are young, if you don't have comorbidities, your disease will pass off, but your mental disease and your fears, they are going to take a longer time. I really want to say that you should take some sessions from psychologists. I have seen many people getting really unwell with mental health rather than physical health. So please do take some counseling sessions. This is for the mild cases, who will try to allay your anxiety and your fears.
Yeah. La Putin is asking, my CT severity score is 7, active lesions. I have had a 2-week quarantine, no other symptoms, but my heart rate is 95 to 100 beats per minute and at rest, and some random chest pains that go away. I'm just 21-year-old. Help.
Just being 21-year-old, having a score of 7 with no further symptoms now, I don't think you need any further therapy in form of steroids. But yes, please, I would say do a D-dimer. If that is high, you might need, I'm not saying you will need, you might need blood thinners for about 2 to 4 weeks. In addition, in younger people, the heart rate does get affected by the COVID-19 virus. In such cases, we do use certain kind of drugs which are known as beta blockers, which is something called bisoprolol. So 2.5 mg, but Again, you consult a physician before you are given these drugs. But at the end, I would like to say you have already recuperated from the disease. Go back to a little bit of exercise, do a D-dimer and a beta blocker. If possible, a scoring of 7 doesn't need any further therapy in form of steroids.
Ma'am, Namisha Botra is asking, isn't wearing mask for long hours harmful as we inhale CO2 which we are exhaling?
Well, I would like to speak. I would urge you to speak to healthcare professionals who keep going inside these areas in masks, followed by shields, followed by taping of those shields and the PPE. So if we can do that much for you, I think everybody is capable of being in mask for longer period of time. If you're not able to do it, please go to an area which is safe enough, you don't have people around, then you can really take out your mask. But if you are in a crowded place, please do keep your mask on.
Yes, really a valid point, ma'am. We understand how entire healthcare system is highly pressurized, and you are working in conditions which are not comfortable because ethically you have to serve. Thank you so much for doing this for the nation, for the society. Well, I'm considering I'm going out for work where I have to wear a mask for a long period, though it is in discomfort. I am wearing double mask. Is that okay, ma'am?
Double masking, I don't think it provides any kind of additional benefit. What is more important is the distance between two people. If you maintain a safe distance between the other person and you're even wearing a simple cloth or a simple mask, that will do the trick. In addition, if you're getting affected with long hours of being in mask, if you're in your office, I suggest in between you take these oxygen breaks. I'm not saying you go and inhale oxygen. I would suggest go out into the open air, take a 10-minute break, go to a corner where there's nobody and you feel the air and the ventilation is proper. Take out your mask, take some deep breath, take some liquids, because it's very hot everywhere. It's the summer season, everybody gets dehydrated. Cannot be known more by health, more than us, because we just get dehydrated by the end of the day when we are in PPE. So go out, go to a corner where you take out your mask, take some liquid, take tea, have a little bit of chat with yourself, take care of yourself, listen to music, and go back to your work and wear these masks. You can keep taking these breaks in between.
Right. And what are the tests required for a person who is diabetic and other comorbidities to, once he's tested positive COVID, what are the other tests that they need to do?
Definitely, there are few tests which are required for people with comorbidities. No, this is not a blanket test format, which I'm going to say. Some people might need some additional testing depending upon their the health issues. Yes, of course, you need a simple CBC, a CRP, a 3-month sugar level, which is HbA1c, to know the level of your control. And in addition, we can do a D-dimer, a simple creatinine value of your function of your kidneys, and SGOT, SGPT, which is the function of your liver. So these are the tests, bare minimum tests, which I'm reiterating, which may be required in people with comorbidity. If I'm saying this because all the labs at the moment are really hard pressed for so many volume, the volume is such that I keep my test bare minimum and decide I do not need every kind of test possible. IL-6 is one of them. Anywhere anybody in the country who's suffering from mild disease does not need a IL-6 value. Please discourage IL-6 being checked in mild cases. This is for a certain strata of people in severe COVID-19, and this will be decided by your ICU doctor. The person who's affected and is in ICU needs an IL-6, not a person sitting at home.
Shubham Chakravarti asks, he has allergies from prawns. Can I take vaccine? And there are a lot of questions. Asthma hai, vaccine le sakte hai. Prawns pe allergy hai, le sakte hai kya? Diabetes hai, can I get a vaccine?
See, all those who have comorbidities in the form of cardiac history, in the form of renal disease, in the form of asthma, which is well controlled, any kind of disease. We have seen people taking vaccines here at our center. It is perfectly safe. You can go to any center, any nearest center, and book your slots, which are available everywhere, including Apollo 247, and get yourself vaccinated. But for people who have allergies, I would, sound certain warning signals where they have to discuss it with their healthcare professional, the doctor who's been taking care of them on a longer term. If they have certain severe allergies, somebody has had breathlessness and choking of breathing with certain foods or certain nuts, they should be careful. So this is one of the things which needs to be discussed with your doctor. Anyway, people are followed up for 30 minutes at the vaccination center where there is adequate facility to take care of these hazardous reactions. But yes, people with allergies should discuss with their doctor whether they can go for their jab or not.
Here's Mr. Amit Kumar who says, what to do if oxygen is below 88 and no hospital or oxygen is available for a few days? What should one do at home and what are the medicines that one has to take in that condition?
It's a very valid question, and I'm extremely sorry for the state of such kind of people. I sincerely, with folded hands, pray to God that they get better and they get a bed anywhere. The most appropriate thing which you can do with them is try and arrange oxygen at home if possible. If that is not possible, oxygen concentrator. Even if that is not possible, you try and make them lie on their stomach. Make them lie on their stomach. If you're able to fix up an appointment with a healthcare professional who will give you further advice what not to do and what not to do. Home care facilities can be of help in such situations. If you have a home care nurse who can take care of the person and put in a cannula at home, they can be given intravenous steroids by the healthcare nurse who will be there at their home. So intravenous steroids, lying on your stomach, giving a little bit of oxygen if available, and taking the appointment with your healthcare professional and discussing further is the bare minimum which we can do for these people.
Right, ma'am. CT score के बारे में बहुत सारे questions है. Varied CT scores that people have been sending. I cannot ask them all here because we're running short of time. Which CT score needs to be admitted into hospital? What is the difference between a CT score and a CORAD score? And who needs to be on the high priority?
See, CT scoring is not something which decides whether a person goes to hospital or doesn't go to a hospital. Now, people get so frantic and they get so panicky about the CT scoring. They keep calling, my CT scoring is 8. You're not responding to my call. I will die at home. It is your responsibility to call me at this particular point. Why don't you help me? So CT scoring is an investigation test. I told everybody that this is a fact that human body is very complex. So CT scoring doesn't decide whether you go to hospital or you do not go to hospital. Hospital is required for people who are visibly breathless, who are less than 88 in their saturation. CT scoring is divided into 3 based on the number of opacities with which your radiologist sees inside your CT scan. Anything 7 or less than 7 is not alarming. Anything 7 to 14 is something which we take care along with comorbidities. If somebody is suffering from certain comorbidities like diabetes, heart conditions, or any renal conditions, we do consider steroids on case-to-case basis, but this is not something which needs to be addressed urgently within hours. It can, wait for about 12 to 24 hours. So please relax, sit down, and try and fix up an appointment with your doctor who you can speak to. Keep your hydration good, and try and follow the symptomatic treatment. People having CT scoring more than 15 along with symptoms of breathlessness need hospital admission. They need steroids, they need blood thinners, they need to lie on their stomach, and they need the hospital attention in terms of other supportive care. So CT scoring per se as a standalone factor does not decide whether a person goes to hospital or doesn't go to hospital.
Right. A lot of people are asking about children and COVID. Like children are infected, what do we do, or how do we protect children? Any suggestions?
Most of the time, children, when affected, they get fever, they get stuffy nose, runny nose, and the usual flu-like symptoms. Now, people are coming up with the fact that more number of children are getting affected. The fact is that per se, the number is so huge, the number is so large that we cannot say that more number of children are getting affected. It's just that, the huge number will have certain strata of children getting affected. Children usually get better with symptomatic treatment, but if a particular child has certain comorbidities in the form of having a previous cancer, they were on chemotherapy, they have certain heart conditions, they have certain lung conditions for which they were on some treatment. So they need to get in touch with their pediatrician who can advise further care. And children who have blue tongue, the fact which I reiterated earlier, might be going low in their oxygenation. Somebody getting unresponsive, the child is not responding. They're not taking feeds. The more smaller children, who are less than 1 year and between 1 to 2 years, they are not responsive. They're not taking any feed. These need an immediate attention and need to be taken to the hospital. But the percentage is very less. And please don't panic and get back to your pediatrician who will decide their treatment.
Okay. There are two important questions. One, do I need to retest after 14 days of quarantine? How many days later can I come out? And after 17 days, if the symptoms still continue, what do I do?
In the first place, mild people and certain strata of moderate people do not need to retest themselves. Please save the labs and please save the tests for other people who need it. You don't need any retesting, because even if we are catching the virus in the test, it might be dead virus by now if you don't have any symptoms. Retesting not required. Isolation for a period of 70 days, starting from the day of symptom, not the day of testing. Day of symptom, count 17, you can come out. The other question, sorry, I just forgot the third one.
The symptoms continue after 14 days. What do
right. There can be certain symptoms which can continue, which can be the milder kind of symptoms, including cough, which can be due to the hyper-responsiveness which a particular person has. So for that, inhalers and nebulizers might help. If you have an underlying condition, you can take a follow-up appointment with your doctor and decide further treatment. But even if after 14 days your oxygen levels are not coming up, you need to contact your doctor, who will decide what further treatment will be required. Small kind of symptoms like having cough, weakness, not able to smell, not able to, having the taste, having little bit of headache here and there, body ache here and there. These are common and these will go away in the third week. So please don't panic.
Just before we wrap up and wind up, I've been scoring to the questions. There are a lot of questions regarding vaccination. Pregnancy, post-delivery, asthma, tinnitus, psoriasis, ecosprin le rahi hu. Can I get my vaccine done?
With the help of our scientists, it is really heartening to know that the vaccination drive is now open to everybody who are 18 or more than 18 years of age. I urge my fellow countrymen and women to please come forward. This is the only way we can curb this huge, large, deadly pandemic and not only help ourselves, but also help our countrymen to prevent them from severe disease. So even if you get the disease post your vaccination, which is 2 to 4 weeks after you have had your second jab, the disease will not be as severe as it could have been after your vaccination. So please come forward, have this jab. Those with comorbidities like cardiac comorbidities, the renal dysfunctions, and the asthma strata, the COPD strata, they can all have their vaccinations. There are not much contraindications. Few contraindications, as we discussed earlier, would be the ones like those having a strong history of allergy, especially breathing difficulty with certain foods or any drugs, need to contact their healthcare professional before they get their jab. And also pregnant women. At the moment, we are not vaccinating our pregnant women. There are studies going on for each and every kind of vaccination. for the vaccine in pregnant ladies. So the studies are still on, except that the mRNA virus in USA, which is in use, which is the Pfizer one, has been used in certain pregnant women, and it has been seen that it is safe. But at the same time, I would like to say, if a woman who's pregnant who comes to a vaccination center and demands vaccination as a voluntary decision, we cannot deny this vaccination. So if somebody wants to have it on their own and by their voluntary decision, they can take vaccination. This is for the pregnant women. But for other people who have already had their deliveries can safely go for the vaccination after about 4 to 6 weeks after their delivery.
Okay. Ma'am, somebody on blood thinners, should they stop blood thinners before they get vaccinated?
People should know that there is a difference between aspirin, which is an antiplatelet drug, and the blood thinners, which are used for certain conditions, including stroke, certain conditions of the heart, which includes atrial fibrillation. Now, these are the drugs which are known as direct oral anticoagulants. And somebody who is on these drugs might be knowing they come by the name of Rovon, they come by the name of Eliquis. So these are the ones who need to stop their medication for about 24 to 48 hours before their jab. This is for the anticoagulants. But they should actually go back to their doctor and discuss it first, because there are certain people, especially those who have had their stenting recently, who cannot take the chance of stopping anticoagulants for 24 hours even. So they should discuss with their cardiologist whether they can stop this medication. For those who are on aspirin, they can safely go and take the vaccination. But the only precaution which they have to follow is that they press their vaccination site for about 15 to 20 minutes. This is true for all those who are on aspirin and anticoagulants. History of cardiac history, go to your cardiologist and discuss it.
Right. Thank you so much, Dr. Viny. We understand that this was a very important session. As I see, there are hundreds of people, thousands of people who have watched this show, and there are more questions which are left unanswered, but we'll make sure that all these questions will get their answers through the answers that were given already. Thank you so much, ma'am. Ma'am, before we leave, one word from you. What's the top tip that you would want to say?
There are certain top tips which I would like every fellow countrymen and women to follow. Please do not panic. Mild disease does not need hospitalization. You need to follow certain treatment for your symptomatic disease in the form of paracetamol for fever, some cough syrup for your cough. In addition, keep a good hydration, eat more of fruits. You can eat anything except the cold beverages directly taken out of the fridge. And also keep moving in the house. Keep your circulation very good. This is for the mild kind of cases. Anybody who's dropping their oxygen levels dangerously should sleep on their tummy. They should get back to their healthcare professional. If possible, find a bed. If they're not able to find anything, please do consider home care and get a nurse who can give you certain drugs in your veins, which can be helpful. Also, I would like to reiterate, take care of your mental health. Do not panic in this situation. Come forward, each and everybody of you who is eligible to take the vaccine, come forward, get the vaccination done. This is helpful not only for you, but for your countrymen as a whole to get this pandemic under curb. This is the only solution at the moment which is left. We don't have anything left in our hands.
Yes, ma'am. Thank you so much, ma'am, for the valuable session that we had today. Thank you so much once again. Ma'am is very busy, we understand, and she'll be getting back to her work. Thank you, ma'am.
Thank you so much. Thanks.
So let's continue with the show. There's an exciting health quiz coming up your way. I'm going to ask you 3 questions, and you can answer in the chat box and win prizes from Apollo 247. Very simply, you have to type question number 1 ka answer, question number 2 ka answer. Winner's name will be announced towards the end of the webinar. And once you're declared a winner, you have to write back to us with your contact details at marketing@apollo247.com. The gift vouchers will be shared with you. Question number 1 for the health quiz this week is, what is the scientific name of coronavirus? What is the scientific name of coronavirus? Pata hai to type kijiye, nahi hai to simple Google kijiye. And please let me know what the answer is in the chat box. Question number 2 coming up. Mention any 3 popular tests done to detect COVID infection in an affected person. Mention any 3 tests that are done to detect COVID infection in an affected person. Question number 2 was that, and question number 3 coming up your way. Which feature on Apollo 24/7 app allows you to talk to a doctor for vaccine-related queries? Which feature on the Apollo 24/7 app allows you to talk to a doctor for vaccine-related queries? Very simple. अगर आपके पास Apollo 24/7 app है, तो जरा app खोल लीजिए and just check what is the tab which says you can consult a doctor if you have any questions after vaccination. Let me see who's the... Oh, there's still questions coming up. We unfortunately, doctor has left and we are not taking questions anymore. Let me look out for the answers. Ankan Mitra, Daksh, Maruti Prabha, Sirigiri, all of you are trying to type, and let me wait for the winners. In the meanwhile, ladies and gentlemen, as we are battling with COVID, a lot of us do not require hospitalization, is what Dr. Viny Kantroo has reiterated. So if you require support while being home isolation, in home isolation, here is Apollo 24/7, which is offering you doctor support COVID-19, which is COVID recovery with Apollo expertise. The benefits of COVID home isolation program are you can consult a doctor regularly. Then also there are regular follow-ups. There is health assistance on call if you are getting out of hand or you require hospitalization. There is health assistance. And there are 2 kinds of packages which you can choose from. The basic plan starts from, which is a 7-day package from 549 rupees only. And the extended package is for 14 days, which is at 999. If you want to avail this doc support COVID-19 from Apollo 24/7, you have to scan the QR code, which is on your screen, or there's a link which is left in the chat box, or on Apollo 24/7, you will find doc support COVID-19, which you can avail these services from. Make sure that you're taking care of yourselves and also others. It's our responsibility. Let's collectively fight COVID-19 ka next wave. All right. So let me see who the winners are. I'm waiting for the winners. A lot of questions, and I'm still waiting for the winners. I think the last... But before we end, we thank our partners, today's telecast partners, Network 18, and a lot of people who have been watching on digital platforms of Apollo Group. Here are gift coupons which we are giving away. Use these coupons on Apollo 24/7 app or on apollo247.com. You use this coupon Apollo 247 to get up to rupees 299 off on online consultation with Apollo doctors. Use the coupon medicine10 to get 10% off on pharmacy orders. Log on to apollo247.com to use the coupons. Thank you so much, all of you. And the winners of Health Quiz are Sai Venkata, Dr. K.S. Arun Kumar, Kumar Gaurav Saxena. Congratulations. Please write back to us with your contact details to marketing@apollo247.com. I repeat the winners. The winners are Sai Venkata, Dr. K.S. Arun Kumar, Kumar Gaurav Saxena. Thank you so much for joining us. There are many questions, but the only way to help ourselves to get answers to COVID-19 is to stay safe, stay home, and get vaccinated. Thank you so much once again. Namaskar.